Well, they didn't even do that. They're supposed to- They did some, but they
Spreadsheet, we're
They
kind
never
of
do it.
notes on it, that you just bring
Yeah,
my
we-
notes. And I'll give a call, because I didn't read it.
Yeah, so.
Life back to normal, Fran?
Yeah, pretty much.
Oh, he doesn't have her crutches.
Pretty much, yeah. We'll be running a marathon. for 2 weeks.
Right.
But there you go. But yeah, walking around anyways, it's nice.
I guess. It
Yeah,
just
but
comes
you got
from,
an extra pen there in your
it
hand.
just comes from the specialists.
Or you just
Get
ask?
about another 6
Oh, I
weeks.
didn't.
Going good.
He just likes to know who has crutches.
Yeah, just tell her to get forward.
We don't have.
It says you're gonna be, it's just being a diabetic, and all this
Yeah.
fixed deposits. Body puts all in your muscles and stuff. It just takes that much longer. What's that? I hate it.
I hate it too.
They keep telling me, go on the bike, they say, can't do the bike, can't do the bike, they say, been able to do the bike for 20 years. When they put me in that, one that both feet,
Were you sitting down with that?
You're up there, something, you know, it's a movement with your feet. Yeah. New step,
Oh, yeah.
that hurt my other leg more than it did when I had surgery.
I like this.
I do.
Oh, I know.
You kind of start going, but then I, so like I didn't.
Yeah, well, for now.
You are doing. You're supposed to be up there.
So that's why we're off.
But I had promised the grandsons, like.
Thank you.
Well, you know, when I.
Oh, so you're right up there.
Yeah, we like.
Good job.
And, well, I guess.
Oh.
I got my bike out. We got ready to go. I got my bike. Why do you have that?
I don't know.
We got it together, I don't know.
Well, they
Am I?
Good morning, everybody. It is 10 o'clock. So I want to welcome everybody to our September meeting of the Health and Human Services Committee.
Are you recording?
Number one on the agenda. You guys ready?
Hey, board members, just so you know, the audio and video is that black box above there. The audio picks up really well. The only thing is talk in the direction of that black box. Above the screen.
Morning, Dr. Lagas. Good morning.
Doctor will be there.
Tell me when you're ready then, Chad. Okay, number one on the agenda is approval of the agenda. And Tanya, you wanted to have me on that?
Yeah, it was my oversight, presentation of the preliminary 2021 budget. So we would like to add that, in place of number 8. We don't have any reports or presentations to give, so we will. add
So
that.
I'll just call for approval of the agenda with the budget added to the agenda. And we will have the budget report on number 8, where it says reports and presentations.
should have the agenda amended.
Moved by Supervisor Wilson,
Second.
second by Oliva. All in favor, say aye. Vote carried. Approval of the minutes of the August meeting. Any questions or?
Boom.
Second.
Got a second? Questions? All in favor, say aye. Aye. Carried. Public comments, we have was this one passed out to all the supervisors from Dave Foster?
In our pack.
Dave Foster lives over by Amory, the veterinary, and at one time he was president of the very concerned, talked to him for a long time at the phone. So, we had it comment, they were forced, and so we did. No other public comments, information from any supervisors. No additions, announcements and committee information. Chad, do you have any announcements on number 7?
No announcements.
We do have the interim public health officer. Right. I think you guys recommend it to the board. I'm not sure what it's just an informational.
Yeah, we will. You'll be approving.
Yes.
We don't really recommendation from the department. Okay, why don't you do number 8 then, give us a report on the budget, then, Tanya.
Well, I'm gonna ask you to move that around a little bit, because I don't have all of the handouts. Yeah, I do. Oh, yes, I do. Kathy will have. You get the handouts. So we have the 2021, public health and community services. So this is the first crack at the 2021 budget. So I would like you guys to pay attention to are the key strategies.
We can take that home and study that, and if you can, if you have any comments on it, you can proceed on that.
Yes, we will ask for amendments at the October meeting. So if you have any questions, and I know that we've been working with Chad and the audit was rated even this year, so we've been kind of under a real time constraints. These budgets put together, so we worked on the key performance indicators. We took those directly from our specific plan for the divisions across the board. If there's any questions on those, we're tying them all back to the first and second board priorities, which are reducing substance abuse, and then also public safety and reducing crime. Most of what we do is related to those two priorities.
With the grants and everything, that's how we're taking in balance, pretty well balanced.
Well, this year's really hard because of COVID. So we've had open positions laid off. We don't have as many placements in ECF. And we're getting a lot of CARES money, so it's really hard to plan for 2020 with all of these different variables coming in at us. So we're kind of taking the 2020 is going to be 2021, at least for our expenditures and personnel.
As a whole, the county's philosophy for 2021 is to budget at or below 2020 levels. Which, you know, when you look at governments around us all the way to the state and federal level, the budget philosophy of 2021 is very speculative as far as what the economy will be like, as far as the recovery. So all the directors have been asked to budget for 2021, 2020. Any major changes within the compound. We anticipate grant aids to pretty much stay stable. That's what we're seeing in the billions coming in. Personal property aids, computer aids, that kind of stuff. So people, what they were last year.
We always budget flat in community services because typically we run over with our mandated services, but this year we did not. In TCF, we SAA money back. I think we reported on that last month. Behavioral health went slightly over, so the, wash that still gave money back to the general fund.
What's DCF?
Department of Children and Families. Shovel.
I would like to speak to that real quickly. So DCFS gave back 202,000 this past year. It was offset by what behavioral health needed, but overall, on the division returned $82,000 back to the general fund. And if you recall, the previous year, we had to fund that division of $670,000. You're talking about a net change of about $590,000.
And the big thing in our department is Golden Age, and it looks like they're gonna be pretty much an even field.
We, we got the Paycheck Protection Program loan for them, the federal loan of about $975,000. And now I'm doing the forgiveness application out. So that should keep Golden Age Manor, that should help tremendously.
Or as you know, for your general inclination, you don't anticipate a tax levy.
An increase?
Increase in tax levy.
No, I mean, our net new construction is finalized at 1.08%. Last year it was 1.13%. So last year was 220,000. The worksheet just came out this week. I've changed it. I think we're probably going to see, additional levy of maybe $205,000. So really we're flat.
Right now, it's looking like sales tax is pretty much increasing by the month.
We're up 6.5% where we were last year, somehow.
And I think, Joe, when you and I were down to when we were down to the convention on the highway, we got kind of a rundown on sales tax throughout the four biggest counties. Showed in one of them was flat. I think it was Brown County. The four biggest counties in the state of Wisconsin showed a slight increase. So it was a good thing for the sales tax. On sales tax. Okay, discussion items, community health improvement plan. We'll follow up on that one.
So they gave the, just a quick follow-up to see if there's any questions. Yes.
Kind of under the mental health part, I take it for granted that when you were doing the statistics for bullying and suicide prevention, are they using the youth risk survey that comes from the DPI for all the schools? I think it's youth risk behavior survey.
Yeah.
Okay, the reason that I asked
So
that.
many licenses per school.
Okay, the reason I asked is so it's consistent for all the schools.
Exactly.
Okay. And I had, the other question that I had is on the goals and objectives for the mental health. Is when the comment that was in there was you're providing psychosocial support for groups for screening. Is there a plan, is there a state plan, a county plan, or does each school district have to have a plan for internal education for those schools?
I'm not sure. I know that Lisa and Elizabeth have worked on the mental health goals for that.
Okay.
What we do in that, here's what we do.
So typically the schools would be responsible for developing that training, but we are more than happy to come in and do that training. So we also try to provide as much education. We're happy to do whatever we can.
Is there a standard?
Not that I'm aware of.
Okay. Well, the reason I ask is that with Unity having a full-time social worker, they have an advantage there for those types of surveys, that type of training, et cetera. So I'm hoping that the other school districts within the county and then the other 71 counties have something to go by when we're doing training. Pretty substantial training, especially when you're doing it in the elementary. Just a comment. Okay, thanks.
Do we have a MOU with all the schools?
Well, so we're working on MOUs for the COVID response of the school. That's what you're referencing, and we don't have signed agreements with all of the schools. We're looking at the corporation council on the level as it relates to the communicate that.
Anticipate that.
Yeah, so just, with, when the corporation council and the lawyers get involved, I want to make sure that we are, sharing information appropriately on who is considered an exposure, what information can be released to the schools, and what time that students need to be home from school. So we just wanted to make sure on the school side and on our side, public sharing.
You think that our whole
I'm not sure what the numbers are, school just started.
I think Unity has 60 kids. I only know it's like part of it. 60 kids, but obviously that's some multiple.
But that's 16.
They're doing the virtual, not homeschool, but the virtual option.
Right, so there's a difference between virtual, hybrid, on-site, and a traditional homeschool where they don't log into the school portal with the data. So that, because it was the weekend, we're waiting for our information. That usually comes out on Monday. So I could give you Friday's information, but
No, I don't.
We don't.
Why don't you do that?
hold on. 1 minute. Under the ribbon.
You have to. I'll click a bubble on the bottom.
So they must not be able to hear us. We need to take our masks off and always speak towards the black box.
Greg, can you hear me? Greg said.
We'll take a little break and see.
Continue on and I'll go check.
Okay. Did you have anything from like last Friday?
We were bumped back up to a high risk category based on our rate of positivity over the last couple of weeks. We've had 181 positives so far since March.
You don't have anybody under quarantine?
There's a lot of people under quarantine. I think they run probably 16.
I'm looking at the graph right now from Friday.
There's 16 isolated. That means there's 16 positive people. The number of quarantines runs about 60 to 65 based on who these 16 have had contact. So there's two buckets that they're keeping an eye on. The ones who are actually have tested positive, which is the 16, and then those contacts to make sure that they write out that 14 days without becoming positive themselves.
Positivity rate, right?
2.29%. As of Friday. I can figure it out. Those numbers on there. So yeah, so watch the county's homepage. Right around 1 o'clock, I think, is when they try to have it updated.
Ted, did you have anything else to do? Correspondence?
The audio is coming in fine when the other offices are watching. It's okay.
Can I ask you a question back on the school thing?
Sure.
So if somebody, and maybe this is a question, you can get, so a kid's in algebra, they test positive. How does that COVID positive test get moved back to us? And how does that algebra class get notified and sent home or quarantined, or what's the process?
So once that child goes to the clinic to get tested, they enter the lab report into a system called WEDS that we have access to. So it's transferred. Once we receive that report in WEDS, then we start the investigation on that positive case to figure out who all that person had contact with. And that's what we're working out with those MOUs and the HIPAA piece of what all do we tell the schools as far as how far does it go. If the child is in school, it's a little bit easier, but if the exposure is outside of school, like they went to grandma and grandpa's house and grandma and grandpa became positive, we don't know like what information do we give to the school on grandma and grandpa and school. So we're still trying to figure that out.
Does all our schools in the county have a school nurse?
No, they don't. Some contract for bits and pieces of school nurses, some have full-time nurses. So they're relying a lot on the health departments and our contact tracers and nurses to help them do that.
That's why I asked a question of MOU.
So to answer your question.
Partially, just about, so is it possible that a kid could be in class and because of HIPAA, we're not able to notify other students in that class?
The exposure during the contact tracing would try to locate those folks. The information provided as to who the person was, and that kind of stuff might not be shared.
But they might be like, okay, this other class had a kid in it and they're going to the other.
Right, if we have a positive and we can say that they spent more than that 15 minutes within that space with that other student or all of those other students, they would all be a part of that contact tracing.
They would all have to quarantine one for 14 days.
Potentially. Isolation is when they are positive. So to think of isolation, start to die, that means they're ill. Quarantine is if they've had an exposure. The problem is when grandma and grandpa are exposed in our example, we are struggling with how do we tell the school how long the student needs to stay out, because of what reason. We're trying to work through that with them. What level of information can we give?
Because they're being quarantined.
Because they are being
Not isolated.
Part of the MOU is all the schools have a isolation room.
That's part of the procedure that the state DHS and DPI came up with for managing.
Did you have another question?
Yeah. I have a question, something that I have noticed that other counties do, Barron County, Quebec County, some other ones, is if there has been kind of an outbreak of positives traced back to a specific event or a specific location, they kind of publicly put out there that if you were in this location on this date and time, and you spent more than 15 minutes there, you may have been exposed, you may want to consider testing and things like that. Is that something that Polk County does, and kind of why or why not?
We haven't had any outbreaks.
We haven't had any to that level, so not on what, we haven't had those public ones, so. Positive person went from here to here to here to here. Right.
Like they would do it.
Yeah, if there was enough of a concern that they were in that situation where people were potentially exposed.
109.
Well, let's bring it back to Supervisor Middleton, the health and all policies as it relates to elections. So I think
Well, I'm not sure, not really, I don't have anything prepared on that except for that we had that resolution. Passed out of here.
We're waiting for some direction from the environmental committee on that.
Well, I think what we said is we sent it up to the board, it would pass, we tried to get it on the August agenda, but it's just, and September is not on, I don't know what the status of it is. So that's all I know. It should be on one of the board meetings. Did we do it in October?
it's not on the county board agenda for next week.
Wasn't right. They didn't have their board meeting.
The way I understood it, I thought that the environmental committee would be action on that.
Well, we're just supporting this concept that the health component should be included in our CAPO policy work. And environment heard our motion, and they know that we've done this. This would be, the board piece would just be sending it up to the board. Okay. Hang on.
I think, didn't this Human Services Board, their previous action was directed at environmental services, right, not at the county board. So there has not been any request to take it to the full county board. Because the way I think it was framed, and I'm just going off of memory, was that this board sent that request to environmental services.
Right.
And there it is, right?
So maybe the environmental board. And the state of Wisconsin, the Wisconsin counties, and I'm on that steering committee, and Wisconsin County is proposing a 2-year moratorium on CAFO and language. And I'm pretty sure with the backing of Wisconsin County, I think the legislature's got a good shot at passing a 2-year moratorium. And I believe that when I talked to the environmental committee that they progress on that. That's where it stands as far as I thought I had the agenda for the environmental committee meeting tomorrow, right?
Yeah, I'm looking at it right now. It's got Resolution 3720, that's to amend the comprehensive land use ordinance related to swine flu. And then an update on the operational based ordinance related to swine tapeworms. That's the only thing I see on here.
And you don't have it, it doesn't look like it's a full board. I'm looking here. So let me just ask a question. So if we drafted that resolution, we would put it all into that format?
Which resolution?
The one we're talking about regarding the health and all policy stuff? That was, it seemed to me it was in a format that goes to the full board. And maybe we don't want to do that now, but I just want to make sure I'm understanding the process.
Well, you need to, either this committee or the environmental services committee would be put it on the county board agenda.
We voted on it.
Send it to environmental services.
Then it's
To
environmental.
just environmental services.
We wanted
If I
it with
recall
the-
correctly.
We wanted it with the conjunction of the environmental committee.
And I'm just, again, going off memory, but I think it was from this committee to environmental services.
And I know they're studying that.
I think that's what, I think when I made that motion, I think the motion was to send it to Environmental Services Committee. Right, they were gonna recommend it to the full committee.
Yeah, there was two motions that day. That
Yes.
one, and then the one, then the one to direct Malia to do the format of the.
And I guess the motion in front of me was to put it back to.
Okay, we're good.
But I think then if we wanted to speak to environmental services tomorrow during the portion that says, you know, supervisors not seated, you can say, hey, guys, what did you do when we sent this to you? So
That's good.
That's only good.
or any of you, I guess.
Yeah.
I think with that, we can move on to C, ordinance number 3020, proposed amendment, Polk County nuisance and human health. And Jason, you address that?
Let's get Anderson.
Yeah, I can.
Jim, you're on.
This is coming from a resolution from last year, 4619.
Right.
They kind of put this into motion, and I guess earlier this year, I kind of fell in our laps to try and start something, and Jason did a bunch of work to try and put the combination based on what was heard from different supervisors into a draft, which you guys had in the packet. It's a really rough draft to what we think we were going to try to accomplish, but more discussion with staff and more discussion with supervisors. It came here from executive committee, and we're looking at putting together a staff work group involved with any of the groups that would be involved in regulating the two different ordinances. So we're talking about zoning, public health, sheriff's office, corporation council, and we're trying to put a work group together to address what was highlighted in the resolution, and then also to bring it to your attention to see if there are additional things that you guys thought were necessary for a rewrite of the human health hazard ordinance and an updated. So that's why it's before you guys today.
And I know a big component of that is where we run into the nuisance, the townships are really involved. And the townships, they have their quarterly meeting, and the township would really be that's where it really started, the township being, I think.
Do the township have a nuisance ordinance?
Some of them, some of the townships I know do, but it's really hard for them, you know, without
Enforcement.
enforcement is always
Yeah.
a proponent that keeps your townships from really enforcing.
I think
Complaints always come to the township level. You go to a town meeting, well, my neighbor, and the defense that the townships have is if they see where it's something that's a health hazard, then the health officer always addresses that. So that's where we're at on that. Well, Tim, did you have any, Jason or anybody else that had anything to say on ordinance discussion?
Yeah, I guess we have some ideas for staff involvement. You guys have any involvement that you would like on this rewrite to keep it in terms of what you guys want to see addressed in the new ordinances? Part of that, have a formal representative, part of that work group.
Just to give some historical context to what's happening with this ordinance, we've had a human health hazard ordinance in place for a long, long time.
Yeah.
And so when you have a house that is full of cats that have urinated everywhere and the house is no longer livable, it's clear that's a human health hazard. And that's really what our health department has been enforcing over the years. Then there was a question of, should we expand that to include things that don't rise to the level of a human health hazard, but are still a nuisance. How involved should the county be in abating public nuisances? And how do we differentiate between whether it's just a private nuisance concern that we shouldn't get involved in, or something that does rise to the level of public concern? How much staff time? In other words, are we gonna have to hire another health officer if we start expanding what we're going to investigate and enforce? And that's the discussion, and that's kind of led to where we are. So I think just to give some context as to why we're talking about this.
It gets so technical, like the decibels of dog barking complaints, and it's such a broad problem.
But you also get complaints about, 20 cars and trash and all this stuff in front of the houses and stuff that you can see right outside. I've been getting a lot of complaints about that too. I think that has to start.
Yeah, there's a junkyard in Frederick that they proposed to do, and that's, from, extract from people seeing how they, or how they take it down. So it's really a unsightly place. Second thing, people in St. Croix Falls are really concerned that the fair board is gonna expand use of the fair with super big truck poles there that can be hit. And I, in favor, noise as a public nuisance also really.
It moves under a decibel.
I have a question. The county ordinance would basically apply to municipalities that did not have their own ordinances. For example, the cities and the villages that have their own nuisance ordinances, the county ordinance would not apply there, or would that apply there?
I believe all of the villages have their own. And we would not interfere
So
with that.
this is mostly for outlying areas or any area that does not already have an existing.
Outside
Oh,
municipality.
Okay.
You know, it's interesting because the statutes are clear that cities, villages, and towns exercising village powers can regulate nuisances, and it's more nuanced as far as the county's ability. So, but again, towns don't really have staff or means and that kind of thing. So that's where there's a bit of a disconnect. But there are counties that do have nuisance ordinances and work with their towns. But it's how much resources, taxpayer dollars are we willing to put into it. Depending upon, if you want to take a look at an interesting nuisance ordinance that was adopted recently, I think it's the town of St. Croix Falls. Yeah, maybe, yeah, not the city, but the town.
I'm on that board.
Okay, and so, really take a gander at that and imagine if we were to investigate these types of complaints, what kind of staff support would we need? And how much money as a board and as a policy priority, when we're looking at all the other things we're spending money on, we want to put towards that effort. Because that's really the policy decision.
For the question, because city of St. Croix Falls, your policy for the ultimate map.
Sure, I suppose the city could adopt their own nuisance, and I think the city already has one. But certainly.
I can't tell you that Brian Hobbs, he does a lot of inspecting, like complaints from the townships, and he goes out and some of these car junk and that, if they're rat infected, something like that. He takes care of a lot of the township.
So in the past, a couple times in this committee, I think it's been mentioned that this nuisance ordinance help you would be a faithful thing. There would be some component of faithful management. Is that true, or is that something we talk about, or is that not? You understand?
Mr. Chair, I can add that,
Please.
address that, and that we have noise, that we also have some proposed air quality standards that are OSHA, based in this ordinance for, ammonium sulfide. So that's all in this proposed draft. Some of those things.
Okay.
So,
I was just going to say, I'm out and about in Grand County, and I'm sure everybody else does too. I drive by things all the time. I think, oh my God, how can that be permitted? How can that happen? How come nobody does anything about it? How come none of these things get cleaned up? I guess, in my opinion, I would like to see the county show some leadership on this issue. The towns, like we said, don't have the mechanism. They should be doing it. Maybe they have the an ordinance, maybe they don't. But they need help in this type of area. And I guess I would like to see the county show some leadership here. Now I understand there's concerns of additional staffing, but nothing stays the same forever. We can't expect that our staffing levels are going to be the same year after year after year after year when there are other issues and other things facing the county that need to be dealt with. And I don't know who it would fall to work with the towns or work with the other municipalities on this. I don't know which department that would fall to. So whichever.
I think it would go through our draft.
Okay. Whatever department it was, perhaps if that department head could, at some point, at the appropriate point, take a look at, if they can give us a projection of what they think staffing levels they would need in order to deal with this, and at least we would have that information moving forward, and, we wouldn't really be guessing, maybe we'll need a staff person, maybe we won't. And I understand until it's enacted and it's being used that maybe you don't really know. But there's some research to be done, see other counties who do something like this, how they handle it. If they have a specific, like a code enforcement officer or whatever within their departments, how they handle it and what the economic impact is to their budgets because of it. I guess I would be interested in that information at the appropriate time.
From the previous meetings in previous years on the board, that what you're saying is kind of the reason why this department is coming up with this draft. That's pretty much what you're saying. They're trying to, I know everything goes by guidelines, let's go level. I think we can see where we've got to take in private people's rights. I know those things get involved. How do we address a summons? What power does the district attorney and everything have? I think we're trying to get everything in a draft as to legal limitations. Do you have anything to add on that?
Well, if you look at what the goals are, because right now we have, if you combine the human health hazard ordinance that we already have and our zoning ordinances, there's a lot of enforcement action the county could be taking on those junkyards, on those, at least in the places where they're zoning. And the staff right now is responding to complaints, but there's no one driving around going, ha, 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 ha. So you have options of either saying, let's look at what we have now and we want to beat that up, or do we want to add more? And so there's a lot of moving parts to this. I think we're at the place where the direction, do you want us to delve into expanding this into a nuisance? Because then we would say, okay, if you want us to be just complaint responsive, our staffing levels, we would estimate this. If you want us to be actively out there engaged and investigating without complaints, then our staffing level will be this. So really that policy direction, I don't think it's gone yet to the county board to sort of steer us. I think we're still in the, thinking stage, the thought storm part of it, where, your ideas, and if you want us to take a lead as a board, and you want to make that recommendation with the Polk County board, then we'll jump on it, yeah.
Got another point?
Yeah, is there, some way a synopsis could be developed for us that would show us, kind of what we currently have and what is proposed, what that would add to that? Because as you were saying, we have zoning and other ordinances that aren't, that we could enforce more than what we are, but due to staffing levels or whatever reasons we're not. What would be the difference between that and this element and this piece of it? And then as well, I think we would have to act on, you'd have it to be complaint based, maybe investigations, if, for us to go out patrolling for it, I don't know that necessarily is
I know that's
a
not
good idea. Yeah, I don't know that that's a good idea, but so complaints are adequately addressed. I've had citizens express concern to me recently that we feel like their complaints haven't been adequately addressed because of staffing.
I can give you my experience on the town of Alden. I think probably the biggest salary yard or whatever in the town of Alden. And we had proposed that we got unlicensed, I think municipalities, they seem to make it work. And I don't know what the difference is between municipalities and the townships, why they can't. But the town of Alden, I don't know if it's in conjunction with the county or not. But anyway, it went to court against this. I believe I know the town, and I don't know if it was in conjunction with the county. They thought that any license that any vehicle that he didn't have license, he could only have so many vehicles. And I know it went to court, I was on the board. Private individual, he won the case. Pretty much, they weren't allowed to infringe on his rights. It gets really technical, doesn't it, Jason, as far as what people do on court?
In the town of St. Croix Falls, we have our own zoning, so we have a zoning administrator. And so we have our own ordinances, like we have a lot of Highway 8 down by along the border there. So we have a sign ordinance, and our zoning administrator, we have a sign ordinance, we should enforce the ordinance then. And that's how most of us on the board there feel. We're gonna have an ordinance, we either enforce it or we don't have it. So we worked with all the businesses along the area, and we're really close to having everybody in compliance now with signs, but we're being real proactive in that, and it's worked. Where we have issues and where we've contacted the county is if we have a home that we think is not fit for a human being to live in, how do you deal with that? So those are the types of things that we struggle with. It's the too many cars thing. We have an ordinance for that. We can take care of that. Signs, we have an ordinance for that. Somebody deciding to sell sheds on Highway 8 without a permit, we have an ordinance for that. So we can take care of all that and handle that through either fines or taking them to court. And we've had success with that. It's those things where it gets to a real health issue, like a house is, like a cat house or one of those types of things. How do you handle that? Because we don't have a good way to enforce those types of things.
That's what Brian Hobbs has done. He's done a pretty good job.
Something that I've seen done in the past that I've worked with myself is that a building inspector and a health officer inspects and writes a report, and the municipality can fix it. And then they have a certain time frame that it has to be, rectified. Most of them decide it costs too much money to bring it up to a livable or a higher standard. And they oftentimes will, try to sell it or abandon it rather because they don't have the money to clean it up, which is sometimes how it gets in that condition to begin with. And I've seen the municipality go in and tear it down. I'm not suggesting we be Nazis and whatever, however you want to put it, and go out and start taking people out of their houses and tearing them down or anything like that, having handed at all. But just like, what was said, it's more working with people. It's more reaching out to them and working with them and trying to get them to voluntarily comply. It's more education than it is enforcement, I think, in many, many cases.
And we do have that. I mean, we have, I'm just thinking historically, we've had a couple of cases where there's an allegation that this home is unlivable because, they have goats and dogs and cats and rabbits and their feces and urine is everywhere all over the house. There's no running water. So then they bring it to me, we go into court, we get a special inspection warrant allowing folks to go in. Then let's say we do find that older gentleman just is physically or mentally unable to, take care of himself. So then we get adult protection involved, and we're looking at mental health issues or whether they can be guarded. So we do have that ability because of the various departments, and we do work together when those things arise, so that we are providing that type of kind of all the way around holistic service, hopefully in those cases.
And that's where the townships and municipalities need help, because they don't have.
Yeah.
And short of coming.
Jason or Bob, do you have anything you want to add? Before, I think everybody's been hearing the discussion on this. Got to be real careful what we're saying outside of our agenda here.
Yeah, just to kind of reiterate some of the things that's been said. At the last executive meeting, this was an agenda item.
Correct.
And we're going to work with staff and looking at this draft, helping using things. The one that is recommending this going because this ordinance is cross division, zoning, our protection. It's our suggestion that we create a work group, cross-section of staff from each of the divisions. Work on this draft, which is looking forward to you. We have you provide some feedback recommendations. Question about staffing is a critical. Really, right now, the architecture, we simply, just people, we don't have the resources to follow together. See the same thing with the health and human. So that's a big question. Take all the rules you want, but you don't enforce it.
That is correct.
It's really tough. So those are two really good points. I'm glad Fran mentioned some alternatives. The idea of a full enforcement officer, provide us with those resources. At the municipal level, you might have one CA and one zoning administrator. They can cover the municipality. You have 20 without a zoning administrator. So the scope of the amount of things that so again, the goal setting, more proactive. We for nuisances, or we want to just adequately respond to complaints. Either way, it's going to cost additional resources. Could be both.
I know there probably isn't a week goes by that you don't get complaint from somebody about something.
Absolutely, that's very true.
Well, my comment is that some years ago, we dealt with a health hazard. We had a big pile of tires, full of water, and we had some mosquito problems there. So I think a lot of effort of this committee to get people to get the points across and check on the types of mosquitoes we had and that pile of hair. That's a risk. Hair sitting on the property. That I just left there. I don't know if this is a problem currently, but
I remember that incident, Dr. Vlogas, and that was on the news media and everything. People were out there. It's a good time. Amy?
So it seems to me in here, Tim asking for maybe someone from our committee, talking about how this all fits together and our discussion about maybe making sure we have staffing, that we should have somebody from this committee on. Is that what you're looking for?
Well, actually, we're looking for an appointment from staff. In particular, we have obviously Mr. Hodge, Tim Anderson, going to facilitate the meetings. We have some ideas. Some folks over perfection. Yeah, as well. I guess what I'm saying is if you have the time, you can read through this draft ordinance that's in the that's our framework, that's what we're starting with. But that's what we're going to first address. Then working collectively, periodically, coming back to this committee. Parallel all that, we should continue to discuss about resources.
I would guess that they're work in progress on that probably 6 months or 4 years.
Yeah, it's it's a contentious ordinance as well, as you can imagine. And I can see some towns and officials that have been supported, as well as people that are proponents of other companies. We've all had experiences with that. So, yeah, it's a long process. And something that we're willing to tackle. Just, it's a helpful exercise, as I said, it's cross-divisional. Which is good for you and your perspective.
We sure appreciate your interest in moving that forward. I think we've pretty much gone through our agenda. Tanya, do you have anything to add before we move to items for the next one? And our ordinance, as we study this as supervisor next month, I mentioned that would be one of the
Right, I think is that a standing item for updates?
Before we adjourn, I want to give a little bit of experience on how we have to stick to the agenda. Some of the things that supervisors are, this is something that I witnessed the first year session on the board in 96, 97. And I got a call from a lady and said that she wanted our committee to take up an issue. She said that she had a daughter, and there wasn't any names used. She had a daughter that was being stalked by another youth on the bus, and while she was waiting for the bus, it was a neighbor. And she said that the sheriff's department had been out there and investigated, saying And she wasn't satisfied, so she gave me a call, wanted me to bring this up on the committee. So I went, yeah, their public protection, said I had got this call from this lady, that she had asked, who didn't mention any names, not even her name. And it wasn't about a month later or so, and I got a subpoena. We had a hearing court, and so he had a personal lawsuit against the investigating officer and myself as the supervisor. And he involved with the lady, mentioned the whole. They, the lady had said in the meeting, privacy laws and everything else. And that went all the way to the district court in Madison. And so supervisors, that's just a personal example of how careful we have to be about everything, things on the agenda, things that are. We have to look alive and be alert. Hope things, anything else anybody's got to add? Amy?
Yeah, one last thing, could we, for our next agenda, put on their, presentation on this groundwater piece, I'd like to know, like, if Mr. Fossil comes in, or, someone from PNR, and I'd like to know sort of county-wide what we got. We've got the also lake data, but I'd like to see what we got county-wide going on.
I think, Jason, you can rest on what's all happening.
Land water, maybe, I don't know.
The well water report?
Yeah.
You just gotta open the records request for that. So, I know the supervisors asked for. So, you can take some of the.
So is it, can we get a presentation next month here?
Presentation, so you can.
We can have it on the agenda for next month.
Okay.
Are you talking about the toxicology report?
I'm talking about the piece that we heard public comment from Mr. Clausen, and then he just had the Balsam Lake piece. So I'd like, so whatever.
We're just looking at that this morning.
Okay.
So we were just removing again.
And one more comment, please.
I would like on the agenda as part of that, that we were able to discuss not just that specific report, but also be able to discuss, well testing, countywide, and if there is a program, if there is resources available, or people have problems with their tests in their well water and health and safety concerns. I'd like to be able to discuss more than just that one specific report, countywide information about what policies are, what happens if people do have a bad well test.
Jason, aren't you in charge of your zoning's in charge of what well testing?
No, those are mainly regulated. So, that road files it. The groundwater study that Bob been referring to. Resources department. And it was a big.
Chairman Bonaprise, we can provide that to you for your packet for the next meeting.
Sure, thanks.
You want a formal presentation, I suppose that can next meeting.
As long as we have something on the agenda, we gotta be careful that we don't go outside of our agenda. Jason, I think there's some congratulations in order. Didn't I see your name in the marriage license column? nothing else,
Yeah, one thing, John, up at the campground this last weekend and other weekends, there's one other supervisor that's up there. 86 units up there. And everybody's saying that the county supervisors have a thankless job. That goes with all the employees too. And it's one of those, you ain't gonna satisfy everybody, and it's dang if you do, dang if you don't.
that's exactly why I made the comment that I did, is to try and help everybody out to live their life and be alert, because
Well, if they're-
there's
Don't
other
get you,
targets
you
out
can't.
there. Motion to adjourn,
So moved.
moved by Supervisor Finley. Second by Nielsen. All in favor, say aye. Next meeting will be October 13th.
I'm not gonna ever.
Thanks, Jason and Tim and Bob, appreciate you having here.
I don't think I've ever seen your face. Like this time, right?
I look for the picture, I'm ready to talk to you.